After fertilization, the zygote travels down the fallopian tube. By day 4, it is divided into a blastocyst. By day 6, it implants into the uterine lining. Let's explore how an embryo moves. Initially, cells cluster and divide, forming the 3 primary layers. Finally, these layers fold and extend, creating the baryonic movement. Implantation is a key step in early pregnancy. It occurs between days 6 and 10 after ovulation. During this window, this timing is crucial for successful pregnancy. Here is the inner wall of the uterus, where the embryo will attach. The embryo travels down the tube and approaches this wall. It then implants into the endometrium, establishing pregnancy. Here we see the morula, a solid ball of cells transitioning smoothly to the blastocyst stage, and the inner cell mass will form the embryo. This fluid-filled cavity is key to implantation. Here, the blastocyst, a small fertilized egg, travels through the uterus. It attaches into the wall, beginning the process of implantation. This is a crucial early step in pregnancy.
Let's look at the implantation timeline from day 4 to 6. On day 4, the morula forms and travels to the uterus. By day 5, the blastocyst hatches and begins attaching. And on day 6, apposition and adhesion occur.
Implantation is a vital step in pregnancy. Let me illustrate on the board. The embryo must attach to the uterus lining. Without connection is critical for not proceed. Some of you might worry about pain during the implant procedure. Let me show you on this diagram. The area is numbed first, so the insertion causes only a brief, light pinch. Any questions? Hello, today let's talk about mild muscle cramps. They feel like a sudden tightening or knot in the muscle. It might ache, but it's usually not serious. Gentle stretching can help. Spotting can happen when the uterine lining becomes unstable. Here in the endometrium, small blood vessels break, causing light bleeding. This is often triggered by hormonal shifts. It's usually normal.
It's important to understand when pain is normal. Mild discomfort after exercise is expected, but severe or persistent pain is not normal.
After your implantation, the rest position is key for recovery. I'll demonstrate. You sit upright with back support, like this. This prevents strain and promotes healing. Rest is crucial for the device to integrate safely. To control stress, focus on slow breathing. Inhale deeply through your nose, like this. This activates your relaxation response. During implantation days, avoid these mistakes. First, do not skip the temperature checks. This is critical. And third, avoid any strenuous activity. It can jeopardize everything. Follow these rules. Hello, everyone. Today, we're discussing safe food handling. As you can see behind me, we have a variety of healthy foods. It's crucial to handle them properly to avoid contamination. Let's get started. Fruits and milk are key to a healthy pregnancy diet. They provide vitamins A, C, and calcium for your baby's development. Including these daily helps prevent birth defects and supports your doctor. During the implantation days, calcium is absolutely crucial. It helps the uterine lining become receptive, supports hormonal balance, and aids the embryo's attachment. Welcome. Let's look at safe fruits for early pregnancy. Bananas provide potassium, which helps with blood pressure. Apples are high in fiber, aiding digestion. Grapes and oranges give vitamins and hydration. Enjoy them daily.
Folic acid is crucial for cell growth and preventing birth defects. You can find it in leafy greens, fortified cereals, and citrus fruits. It's especially important for pregnant women and overall health.
On day 4, the fertilized egg becomes a morula, a solid ball of cells. By day 5, it develops into a blastocyst with an inner cell mass and outer layer. On day 6, the blastocyst is ready for implantation.
When performing an implantation, avoid these critical pitfalls. First, prevent infection by ensuring strict aseptic technique. Next, avoid improper placement, which can cause rejection. Finally, ensure continuous patient monitoring.
Good morning. Today we're talking about hydration. This water bottle is a simple tool for staying hydrated. Water helps your brain, digestion, and energy levels. So, drink water throughout the day. Heavy work can overload your system, leading to crashes. Imagine this is the full capacity. Now, adding more tasks causes it to overflow. So avoid heavy work to maintain efficiency. Here we see the embryo attaching to the uterine wall. The placenta is forming, and this attachment is becoming stronger. Stronger blood vessels are growing to support the embryo. This ensures a stable pregnancy.
During puberty, the hypothalamus releases GnRH, which signals the pituitary to produce LH and FSH. These then act on the gonads and secondary sex characteristics as detailed here. Let's discuss implantation, which occurs between days 4 and 6. The blastus reaches the uterus and begins to attach. It then invades the uterine lining to establish pregnancy. This is a critical step for development.
Our moods change throughout the day, and that's completely normal. We might feel happy, then sad, then calm again. Understanding these changes helps us manage them. Hello, today let's talk about why relaxation is so important for implantation. When you're relaxed, your body reduces stress hormones, which helps blood flow and it helps create the best conditions. Let's begin a breathing exercise to control stress. Inhale deeply through your nose for 4 counts. Hold for 4, then exhale them helps calm your mind. Hello, today I'll show you the best sleep position. This is a supportive bed set. Lie on your back with your head on the pillow. This aligns your spine for proper rest. Welcome. Today we're discussing prenatal vitamins. This bottle contains essential nutrients for pregnancy, iron and curcumin for preventing and baby's growth. Let's explore the benefits. Observe this chart. The embryo is attaching to the uterine wall, the trophoblast invading deeper into the endometrium. This deeper attachment is crucial for a successful pregnancy. Any questions on this process? Hello, today I'll show you the best sleep position. This is a supportive bed set. Lie on your back with your head on the pillow. This aligns your spine for proper rest.
Worrying is normal, but when it disrupts your daily life, it's time to seek help. If physical symptoms appear, like chest pain, don't wait, talk to someone. Understanding this helps you respond wisely. Let's use this calendar to plan our project timeline. We'll start on day 4 and continue through day 5 and day 6. This gives us a clear visual of our timeline.
This illustration shows how the body prepares for pregnancy. The belly area develops to support the baby, while hormonal changes regulate the entire process for a healthy outcome. Let's recap the implantation timeline. By day 6 or 7, the blastocyst contacts the uterine lining. Adhesion and invasion begin around day 8, and by day 10, implantation is complete as the placenta starts to form.
Here we see the embryo attaching to the uterine wall. After initial contact, cell integration begins. By day 6, the connection is stable. This stability is critical for development.
Here we see the embryo has successfully attached to the uterus wall. The animation shows the embryo cells integrating with the uterine lining. This attachment is crucial for a successful pregnancy. Our bodies need more energy now to keep up with our busy lives. Eating healthy foods like this gives us the fuel we need. This plate has smart choices to stay energized. Today, we're looking at these green vegetables. They're packed with iron, which is essential for our blood to carry oxygen. Spinach, broccoli, and green beans are all great sources. Including them in your diet helps prevent iron deficiency. Hi, everyone. Let's talk about safe snacks for early pregnancy. A fresh apple is a great choice. It's full of fiber and easy to pack. And a banana is perfect too. It has potassium and simple and healthy. Junk food is high in unhealthy fats, sugars, and salt. This can lead to serious health problems like obesity, heart disease, and diabetes. It's best to avoid these foods and choose healthier options.
So, as I showed you before, this glass of water is key to staying hydrated. For your daily routine, aim to drink one of these every few hours. This simple habit keeps your body and mind functioning at their best.
Light spotting can be normal during your cycle. This chart shows it's often due to hormonal changes. If it's persistent or heavy, please consult your doctor. Abnormal spotting is not normal and can indicate a serious health issue. It could signal conditions like hormonal imbalances or even cancer. If you experience this, see a doctor immediately.
Hello, everyone. Today, we'll discuss why consulting a doctor is so important. Doctors provide accurate diagnoses and safe treatment plans. This prevents complications and ensures your well-being advice.
All right, class, let's mark the implantation days as complete. I'm writing complete right here on the calendar. With that phase done, we now begin organogenesis. This is a critical time for development. It's normal for our emotions to change. We might feel happy, then sad, and that's okay. These shifts are part of being human, and understanding them helps us grow. Let's begin our light walking exercise. Gentle, slow steps are completely fine. Focus on the movement, not the speed. This is great for building awareness. Great job. Let's slowly come to a stop. Some medicines should never be taken without a doctor's advice. For example, antibiotics or strong painkillers can be dangerous. Always look for warnings like this on the packaging. When in doubt, consult your doctor. Hello, let's review how to take your prenatal vitamins. Take 1 tablet daily with a meal and water. For best results, take it at the same time each day, and always consult your doctor.
This diagram summarizes the full dental implantation process. We begin with the extraction site. Next, the titanium is placed into the jawbone. The abutment is then attached, and finally the crown is placed. Let's recap the key tips for success. Tip 1, review key concepts daily. Tip 2, practice with past papers. Tip 3, stay calm and focused.
In our next video, we'll explore the changes during days 7 to 10 of pregnancy. This is a crucial stage, so stay tuned for the details.
To conclude, the key is understanding the core principles we've discussed. These concepts will serve as a foundation for your future studies. Thank you for your attention, and I wish you all the best.